how to manage hamstring strain. How do you know if you have a hamstring injury? Do you have pain in your lower back, maybe in your butt? Well, if your pain starts from the sitting bone and it radiates down, not to your toes, just stops at your knee, you might have a hamstring injury. It usually happens from sprinting type injury. It could also happen from excessive stretching with your knees straight and hip flexed. You can tell them I have very tight hamstrings, or even from repetitive sitting. That compression onto the hamstring tendons is enough to trigger it. So what do? First thing, you want to avoid any type of movements and flexion that can increase the pain for the first 4 to 6 weeks. Take some anti-inflammatories such as Advil, naproxen, aspirin. They can be kind of helpful, but if you take too much, it's not so good for your stomach or for your kidneys. Next, supervised exercise. So I would recommend starting with isometric exercise. Feel free to check out this video for details on these exercises that can help with pain. A physiotherapist to guide you through the proper forms of the exercise could be important as well. You want to make sure you're pain-free before you move on to the next step to prevent further injuries. But what if you tell me, hey doc, I get it, but I really want relief with these pain right away. I got things to do. I tried all the exercise you told me, but it's still hurting like hell. What do you do next? Well, that's where injection comes in. There are different types of injections. Steroids is cheap, readily available, takes away the pain in the short term, but in the long term, it's not so good for the tendons. There's more and more studies that shows steroids into the tendons is quite toxic, and it can weaken the tendons and potentially increase the risk of rupture. PRP, on the other hand, platelet-rich plasma, where we take your blood, spin it down into the good stuff, the growth factors, and injection into the tendons itself. Not only does it help with pain relief, decreasing the swelling, it actually potentially can increase and help the tendon regenerate. It's good for the long term. There's barely any side effects. Downside though, it's often not covered by MSP, almost always, so it's more expensive. Now, in the rare cases where injections and all these treatments don't work, that's where you see the surgeons and talk about tendon repairs.